Acetaminophen, also known as paracetamol, is mainly used to treat pain and fever. These conditions are related to an increased production of pro-inflammatory chemicals called prostaglandins. Now, acetaminophen works by decreasing the production of prostaglandins, thereby relieving pain and reducing fever. So in order to understand how acetaminophen works, first we need to talk briefly about inflammation, which is the body's response to a harmful stimulus, such as infection or injury. So during inflammation, your immune cells use an enzyme called phospholipase A2 to take membrane phospholipids and make a 20-carbon polyunsaturated fatty acid called arachidonic acid. Arachidonic acid is a substrate for an enzyme called cyclooxygenase, or COX. The enzyme cyclooxygenase exists in two different isoforms, COX-1 and COX-2. COX-1 is a constitutive enzyme, meaning that it's always active, while on the other hand, COX-2 is an inducible enzyme, meaning that it must be turned on to function. This is usually triggered by immune cells and vascular endothelial cells during inflammation. Both enzymes produce prostaglandin E2, PGE2, and prostacyclin, PGI2, which cause vasodilation and attract different immune cells to the area. They also act on neurons that detect pain, called nociceptors, and make them more sensitive to stimuli by lowering their threshold for activation. Finally, they stimulate the hypothalamus to increase the body temperature, causing fever. Prostaglandin E2 also has other effects like causing uterine contractions, decreasing the secretion of acid, and increasing the production of protective mucus in the stomach. Alright, now let's focus on acetaminophen. Acetaminophen is administered orally, rectally, or intravenously, and it works by reversibly inhibiting COX in the central nervous system, thereby decreasing production of the prostaglandins that cause fever and pain. It's important to note that acetaminophen is not considered a non-steroidal anti-inflammatory drug, or NSAID, because it doesn't inhibit COX peripherally, so unlike NSAIDs, it doesn't have anti-inflammatory activity. Common indications for acetaminophen include fever and mild to moderate pain, such as myalgia and headache. Although it's mainly used alone, it can be co-administered with other medications, such as ibuprofen or morphine, to treat severe pain after operations. Moreover, because it doesn't affect COX and platelets and in the stomach, acetaminophen is a preferred drug in the treatment of fever and pain in individuals with bleeding disorders, peptic ulcers, and individuals allergic to aspirin. Also, it's the first-line therapy for children with fever or pain because aspirin can cause Ray's syndrome, which is a life-threatening condition that can occur after a viral infection. It's characterized by progressive encephalopathy and liver degeneration and is linked with aspirin use. Alright, let's move on to the metabolism of acetaminophen, which is done by hepatocytes in the liver. Hepatocytes mainly metabolize acetaminophen by glucuronidation and sulfation into non-toxic metabolites, which are then excreted in the urine. But a small amount of acetaminophen is also metabolized by cytochrome P450 enzymes to a highly toxic metabolite, N-acetyl P-benzoquinone imine, or NAPQI. Normally, this toxic metabolite is inactivated by an antioxidant called glutathione. So in therapeutic doses, acetaminophen doesn't cause severe side effects. But if someone takes too much acetaminophen, the hepatocytes can't break it all down. So more acetaminophen undergoes cytochrome P450 metabolism, which creates more NAPQI. Now, because there's a limited amount of glutathione in hepatocytes, high levels of NAPQI will deplete them, causing a buildup of NAPQI. This toxic metabolite will start causing cell death and acute hepatic necrosis. Acetaminophen toxicity is the most common cause of liver failure in the USA. It's important to note that it could even occur with therapeutic doses in individuals with low glutathione stores, such as infants, elderly, individuals with malnutrition, or with a genetic condition called glutathione synthesis deficiency. On the other hand, chronic use of alcohol, or some medications like barbiturates, phenytoin, and carbamazepine, can enhance the activity of CYP450, so more NAPQI is produced. Early symptoms of toxicity are nonspecific, and they include nausea, vomiting, and abdominal pain. But as a liver injury progresses, Symptoms worsen and individuals may have jaundice, coagulopathy, hepatic encephalopathy, and acute renal failure. Treatment consists of administration of N-acetylcysteine, or for short, NAC, which replenishes glutathione and prevents its depletion. Alright, as a quick recap. Acetaminophen, also known as paracetamol, is mainly used to treat mild to moderate pain and fever, but it can also be co-administered with other medications to treat severe acute pain. Acetaminophen is administered orally, rectally, or intravenously, and it works by reversibly inhibiting COX in the central nervous system. Finally, acetaminophen toxicity is caused by an increased production of NAPQI, which results in hepatic necrosis and liver failure, and it's treated by administration of N-acetylcysteine.
Non-steroidal anti-inflammatory drugs, or NSAIDs, are mainly used to treat inflammation, pain, and fever. These conditions are related to an increased production of pro-inflammatory chemicals called prostaglandins. NSAIDs work by decreasing the production of prostaglandins, thereby reducing inflammation, relieving pain, and reducing fever. In order to understand how NSAIDs work, first we need to talk briefly about inflammation, which is the body's response to a harmful stimulus, such as an infection or injury. So, during inflammation, your immune cells use an enzyme called phospholipase A2 to take membrane phospholipids and make a 20-carbon polyunsaturated fatty acid called arachidonic acid. Arachidonic acid is a substrate for an enzyme called cyclooxygenase, or COX. The enzyme cyclooxygenase exists in two different isoforms, COX-1 and COX-2. COX-1 is a constitutive enzyme, meaning that it's always active, while on the other hand, COX-2 is an inducible enzyme, meaning that it must be turned on to function. This is usually triggered by immune cells and vascular endothelial cells during inflammation. Both enzymes produce prostaglandin E2, or PGE2, and prostacyclin, or PGI2, which cause vasodilation and attract different immune cells to the area. They also act on neurons that detect pain, called nociceptors, and make them more sensitive to stimuli by lowering their threshold for activation. Finally, they stimulate the hypothalamus to increase the body temperature, causing fever. Prostaglandin E2 also has other effects, like causing uterine contractions, decreasing the secretion of acid, and increasing the production of protective mucus in the stomach. So, in conditions such as inflammation, pain, or fever, NSAIDs can be used to inhibit cyclooxygenase and decrease the production of prostaglandins. Depending on how they interact with these enzymes, NSAIDs are subdivided into two main groups: irreversible COX inhibitors, like aspirin, and reversible COX inhibitors, or non-aspirin NSAIDs. Non-aspirin NSAIDs can be further subdivided into two groups: non-selective COX inhibitors, which include common medications like ibuprofen, and selective COX-2 inhibitors like celecoxib. Alright, now let's start with aspirin, also known as acetylsalicylic acid, which works by irreversibly inhibiting both COX-1 and COX-2. Aspirin is taken per orally, and most of the absorption occurs in the ileum. Once absorbed into the bloodstream, aspirin irreversibly inhibits COX-1 in platelets by covalent acetylation, thereby decreasing production of thromboxane A2 in platelets. Since thromboxane A2 is a platelet activator, this makes aspirin useful as an antiplatelet medication. Since aspirin irreversibly prevents the platelets from synthesizing new COX-1 enzymes, aspirin's effect will persist until there are enough new platelets produced that are able to produce COX-1 enzymes. This leads to increased bleeding time without affecting PT or PTT. Next, in the liver, aspirin is metabolized into salicylate, which doesn't have the antiplatelet effect, but it does have anti-inflammatory properties. Salicylate works by inhibiting COX-2, thereby reducing prostaglandin production, leading to decreased inflammation, pain, and fever. So, it's commonly used to treat headaches and musculoskeletal pain. It's also used for the short-term treatment of chronic pain like osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis. It's important to note that the effects of aspirin are dose-dependent. Low doses under 300 milligrams per day work as an antiplatelet medication. Medium doses between 300 and 2400 milligrams per day work as an antipyretic and analgesic. And high doses over 2400 milligrams per day work as an anti-inflammatory medication. Low doses, or baby aspirin, in the form of 81 milligram tablets are used long-term to help prevent heart attacks, strokes, and blood clot formation in people at high risk of developing blood clots. Okay, moving on to non-selective COX inhibitors, which reversibly inhibit both COX-1 and COX-2. Common medications in this class include ibuprofen, naproxen, ketorolac, indomethacin, Solindac, meloxicam, and many others. All these medications can be taken per orally, but ketorolac, ibuprofen, and indomethacin are the only NSAIDs that are also available in parenteral form. Just like aspirin, these medications inhibit COX-1 and have an antiplatelet effect. But because they're reversible inhibitors, their effect is transient, so they won't provide the same benefit as aspirin. If taken together with aspirin, they will even compete for the binding sites on COX-1, which results in a decrease in the antiplatelet effect of aspirin. Next, these medications also inhibit COX-2, which reduces inflammation, pain, and fever. So, they have the same indications as aspirin. However, ibuprofen, naproxen, and indomethacin are also used to reduce inflammation during an acute gout attack, where aspirin should be avoided since it competes with uric acid for excretion in the kidneys, which might worsen the symptoms of gout. Indomethacin is also used to close patent ductus arteriosus in neonates and premature infants, while ketorolac is used to treat severe acute pain, usually after surgery. Now, moving on to selective COX-2 inhibitors. The main medication in this group is celecoxib. Celecoxib reversibly inhibits COX-2, so it can treat pain and inflammation like the other NSAIDs. But since it doesn't affect COX-1, it lacks the antiplatelet effect seen in aspirin. On the other hand, it doesn't compete with aspirin for COX-1 like the reversible non-selective COX inhibitors do, so it can be combined with aspirin without decreasing its antiplatelet effect. For side effects, both aspirin and the non-selective COX inhibitors can cause problems by blocking COX-1 in many parts of the body. Inhibition of COX-1 in the stomach decreases the concentration of cytoprotective prostaglandins, which can lead to gastritis, gastric ulcers, or even bleeding. Reversible inhibitors of COX-1 cause less gastrointestinal problems when compared to aspirin, and selective COX-2 inhibitors like celecoxib cause the least GI side effects since they don't affect COX-1 at all. In the kidneys, all NSAIDs inhibit COX-2, which decreases the level of prostaglandins that dilate the renal artery, causing a reduction in renal blood flow. This reduced blood flow tricks the kidney into thinking that the blood pressure is low, so in order to increase it, they activate the renin-angiotensin-aldosterone system, which can lead to hypertension. An interesting fact is that low doses of aspirin can actually lower the blood pressure, but only if taken right before bedtime. The mechanism behind this is still being studied, but high doses of aspirin will increase blood pressure like all the other NSAIDs. Now, when the blood flow to the kidney is reduced, it can lead to acute kidney injury, which is particularly true in the elderly and individuals with underlying heart, liver, or kidney disease. In addition, chronic abuse of NSAIDs in these individuals can lead to analgesic nephropathy, which can manifest as chronic nephritis or renal papillary necrosis. Other side effects include hypersensitivity reactions that could lead to side effects, such as Stevens-Johnson syndrome, toxic epidermal necrolysis, and anaphylactic reactions. It's also important to note that individuals who experience hypersensitivity to one NSAID can also experience the same reaction when taking other NSAIDs due to cross-hypersensitivity. People with nasal polyps and asthma are also more likely to experience NSAID hypersensitivity, and these three together are called Samter's triad, or aspirin-exacerbated respiratory disease. For medicine-specific side effects, aspirin needs special attention. First, it should not be given to reduce fever in children with viral infections, as it can lead to Reye's syndrome, which is a condition characterized by liver damage and progressive encephalopathy. However, aspirin can be used in children to reduce fever in Kawasaki's disease. Next, an aspirin overdose can be fatal. Early symptoms of salicylate poisoning include tinnitus, deafness, headache, and vomiting, while at high doses, salicylate can directly stimulate the respiratory center and cause hyperventilation and respiratory alkalosis. Moreover, as the dose increases, salicylates start to inhibit oxidative phosphorylation, which is used to generate energy in the aerobic pathway. So, the body switches to the anaerobic pathway, which produces lactic acid. And the increase in lactic acid eventually causes an elevated anion gap metabolic acidosis. As blood pH decreases, salicylate shifts more towards its non-ionized form, salicylic acid, which easily crosses the blood-brain barrier and causes seizures or even coma. It's important to note that there's no specific antidote for aspirin overdose. Instead, treatment includes administration of activated charcoal, which binds aspirin and prevents its absorption in the GI tract, alkalization of urine by sodium bicarbonate, which facilitates salicylate excretion, ventilatory support, and the management of the acid-base imbalance. Now, we want to make a simple and fun mnemonic that'll help you efficiently memorize and retain all of these farm facts. So, fittingly, let's use a chicken farm full of roosters, or cocks, for the NSAIDs, which inhibit COX enzymes. Now, in the first coop, there are 2 dead roosters, one with 2 heads for COX-2 and one with a single head for COX-1. These roosters are dead to help you remember this coop contains the non-reversible COX inhibitors. What killed both of these chickens are the 2 giant springs, representing aspirin, and you can see them sticking out of the roosters' chests. For indications, let's have the chicken's dinner plate broken into pieces to represent aspirin's antiplatelet effects. There's a thermometer for its antipyretic effects, and the temperature is so high it bursts into flames, representing its anti-inflammatory effects. Okay, now in the next coop, we have 2 similar roosters for COX-1 and COX-2, but they are still alive, because our reversible COX inhibitors are in this coop. Both of these roosters saw what happened in the first coop, so they took some preventative measures. One is wearing a bulletproof vest for ibuprofen, while the other is reading medical books because he's into medicine, or indomethacin. This book is really hard though, and it's making him cry, so let's give him a box of napkins for naproxen. Finally, as an extra precaution, the bulletproof chicken tore the key to the coop in half for ketorolac. For indications, all these medications are used to treat pain, inflammation, and fever. So, there's a flaming thermometer in this coop. But they can also be used for gout, unlike aspirin. So, let's put a big toe with uric acid crystals roasting above the flame. For medication-specific indications, a tiny surgeon is trying to repair the key since ketorolac is used after surgeries. Indomethacin is used to close patent ductus arteriosus. So, on the medical book, let's put a picture of a heart with a duck face inside. The last coop only has 1 rooster, and it's alive, and it's got 2 heads. So this is where we put the reversible selective COX-2 inhibitors. So let's have both heads fighting over a stalk of celery for celecoxib. This coop has the same thermometer with a big gouty toe, since celecoxib has the same indications as the reversible non-selective COX inhibitors. For side effects, let's put a bleeding stomach outside each of the coops to represent gastritis and gastric ulcers. The bleeding is most severe in front of the aspirin coop, less severe for the reversible non-selective coop, and there's almost no bleeding at all for the one in front of the celecoxib coop, since that one doesn't affect COX-1. Next, let's put a dying kidney with a tight blood pressure cuff wrapped around its neck in front of all three coops, since all NSAIDs affect COX-2 and can cause kidney damage and hypertension. For cross-hypersensitivity, let's put X-shaped boards in front of the door of each coop. On the ground, by the door of the aspirin coop, there's a triangle for Samter's triad. One point is next to the hypersensitivity cross, the next point has an asthma inhaler, and the last point has a big nose with a polyp growing out of its nostril. Finally, let's go on top of the aspirin coop for some of its specific side effects. First, there's a slice of half-eaten rye bread, which represents Reye's syndrome. Next, for aspirin overdose, let's have a young man who represents the early symptoms. He's wearing headphones for the ototoxicity, and he's snorting baking soda through a straw for respiratory alkalosis. Next to him is an older man who represents the later symptoms. This man is in a coma for the CNS toxicities, and next to him are spilled metal cans of acidic soda for metabolic acidosis. Alright, as a quick recap. NSAIDs, or non-steroidal anti-inflammatory drugs, work by the inhibition of COX enzymes. Irreversible COX inhibitors include aspirin, which works on both COX-1 and COX-2, so it's non-selective. Reversible COX inhibitors include medications like ibuprofen, which is also non-selective, and celecoxib, which is selective for COX-2. All NSAIDs can be used to treat pain, inflammation, and fever, but only aspirin is used as an antiplatelet medication. Common side effects of NSAIDs include stomach problems, kidney damage, hypertension, and hypersensitivity reactions. Lastly, aspirin overdose is potentially lethal and can cause hearing problems, respiratory alkalosis, metabolic acidosis, and coma. But wait, there's more. Here's a mind map with all of the mnemonics. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers after the credits.
Opioid agonists are medications used mainly to control acute or chronic pain in particular situations. Some of them are also used to treat diarrhea and cough. When treating pain, the goal should be to use short-acting opioids at the lowest effective dose for just a few days, and slowly increase their dose only as needed. As a class, opioids share one thing in common. They bind to opioid receptors in the brain, spinal cord, and gastrointestinal tract. Some are endogenous, meaning they are produced naturally by the body, like endorphin, short for endogenous morphine. But others are exogenous, meaning they come from outside the body, like heroin and morphine, which come from the opium poppy, a flowering plant that oozes a milky white liquid. To understand how opioids work, let's zoom into a region of the brain tissue that has opioid receptors. Normally, in the absence of endorphins, inhibitory neurons secrete a neurotransmitter called gamma-aminobutyric acid, or GABA, that prevents nearby neurons from releasing neurotransmitters like dopamine, serotonin, and norepinephrine. Now let's say someone goes to play a rigorous game of badminton. Exercise releases endorphins, which activate the three major opioid receptors located in the inhibitory neurons, called the mu, kappa, and delta receptors. As endorphins bind to these receptors, they block the inhibitory neuron from releasing GABA, allowing the dopamine, serotonin, and norepinephrine secreting neurons to freely unload their neurotransmitters, which then get picked up by another neuron in the same area. Norepinephrine and serotonin release takes place in pain processing regions of the brain, like the thalamus, brainstem, and spinal cord, resulting in a decreased sensitivity to pain. When dopamine release takes place in reward pathway regions, like the ventral tegmental area, nucleus accumbens, and prefrontal cortex, the result is a calming sensation that feels really good. Okay, So even though all opioids bind to opioid receptors, not all of them have the same effect. Some opioids, like morphine, just act like endorphin, and when they bind to the opioid receptors, they trigger a full response that results in the complete inhibition of GABA release. These are called full agonists. Others, like tramadol, have a weaker effect since they only partially inhibit GABA release. These opioids are called partial agonists. Now, some opioids act preferably on the mu receptors, others on kappa or delta receptors. In fact, they can have an agonist effect on one receptor and an antagonist effect on others. These are called mixed agonist antagonists. First, let's look at some full agonists. Commonly used medications in this class include morphine, methadone, fentanyl, meperidine, codeine, hydrocodone, and oxycodone. Although not a medication, heroin is also a full agonist. Since opioids are the strongest analgesics available, they can typically be given perorally, intravenously, or through patches in the case of fentanyl to control pain that couldn't be eased with non-opioid medications. Fentanyl is the most potent full agonist, and it's also used as an anesthetic medication due to its rapid onset and short duration of action. Meperidine can be used to relax uterine muscles and inhibit contractions during labor. However, it can produce respiratory depression in the baby. Codeine is a weaker full agonist and is often taken perorally with other analgesics like acetaminophen to treat moderate pain like headaches. Due to an unknown mechanism, codeine and hydrocodone are also useful as an antitussive to relieve cough in adults. Unfortunately, opioids have a high risk of causing opioid dependence. Since they cause a wonderful euphoric feeling, there's an increased risk of abuse and addiction. Methadone is an opioid that does not cause euphoria and has a long half-life, so it's often given to decrease withdrawal symptoms for people with opioid use disorder or heroin addiction. An added benefit is that it also blocks the euphoric feeling that comes from taking other opioids, so it helps to prevent future abuse. There are also some opioids that don't have any analgesic effects. For example, dextromethorphan is only used for its antitussive properties. Loperamide can't cross the blood-brain barrier, so it's used to reduce the motility of the gastrointestinal tract and treat diarrhea. Now, common partial agonists include buprenorphine, butorphanol, pentazocine, and tramadol. The first three are mixed agonist antagonists. Buprenorphine is a partial agonist at the mu receptor, but an antagonist at the kappa receptor, while butorphanol is a partial agonist at the kappa receptor, but an antagonist at the mu receptor. Pentazocine is a partial agonist at the mu receptor and kappa receptor. All three can be used to manage moderate pain. Tramadol is a partial agonist at the mu receptor and is used for moderate to severe pains, often after surgery. Now, if these medications are given with a full agonist, they'll compete for the same receptors and decrease the overall effect. Now, this could be a good thing. As a partial agonist, buprenorphine can stimulate opioid receptors enough to decrease cravings and withdrawal symptoms in people with opioid use disorders. However, it's not potent enough to cause an overdose or trigger the euphoric feeling, which makes it a safer alternative to methadone. Okay, let's move on to some side effects. In the central nervous system, excessive stimulation of opioid receptors can cause euphoria, but sometimes also dysphoria when the person feels unhappy and dissatisfied. Stimulation of opioid receptors in the GI tract cause a decrease in motility and constipation, but they increase motility in the biliary tract, which worsens the pain during biliary colic. Other side effects include pinpoint pupils or pupillary constriction, flushing, and nausea. Now, an opioid overdose is very dangerous. First, there's cardiac and central nervous system depression, which could lead to arrhythmias and coma. Since the CNS depression is additive with depressants like alcohol and other medications like barbiturates, they should never be used together. The most common cause of death from opioid use is respiratory depression due to decreased activity in the medulla, the part of the brain that regulates breathing. This causes increased carbon dioxide retention, so it accumulates and causes dilation of blood vessels, including those in the brain. Cerebral vasodilation increases intracranial pressure, which is why opioids are also contraindicated in patients with head injury, since they are already more susceptible to increased intracranial pressure. Opioids should be avoided whenever possible during pregnancy, because they can cause dependence in the baby. Finally, if a chronic user of opioids stops treatment, they could experience withdrawal symptoms like anxiety, agitation, confusion, sweating, and the feeling of skin crawling. The good news is that over time, an individual can safely taper off their use of opioid treatments altogether. Severe withdrawal symptoms can be managed with methadone and buprenorphine combined with naloxone. Now, we want to make a simple and fun mnemonic that'll help you efficiently memorize and retain all these pharmacology facts. Let's start with a small garden full of poppy plants. The left side is full of fully grown poppies representing full agonists, while the right half contains half-grown plants representing partial agonists. So on the left side of the scene, we'll put a mighty morphine punching ranger, fighting a giant roadrunner going, meet me, and an ox with a fur coat. They're definitely going to need analgesics after their fight, which is good since they represent morphine, meperidine, and oxycodone. Now, they're disrupting a programmer writing code for codeine. His computer is cooled by a water cooler that represents hydrocodone. This programmer is clearing his throat loudly at the obnoxious brawlers to help you remember that both these medications can also be used to treat coughing. Next, let's have a mastodon, representing methadone, hanging up anti-drug posters, since it can treat opioid use disorder. Finally, there's a wizard from a fantasy novel, representing fentanyl. He's sleeping soundly, which will help you remember it's sometimes used as an anesthetic. Okay, moving on to the other side for the partial agonists. We have a burping orphan hanging up anti-drug posters, representing buprenorphine to treat opioid use disorder. His brother is wearing a butterfly costume for butorphanol. They are standing inside a pentagram representing pentazocine. Buprenorphine is standing at one point of the star with a mu symbol, since it's a partial agonist here. At the opposite point with a kappa symbol is butorphanol, since he's a partial agonist for that receptor. Since the pentagram contains both mu and kappa, it's a partial agonist for both receptors. They are standing near a tram track representing tramadol, and if the tram hits them, they're both going to need analgesics. Alright, let's go over some of the side effects. We'll put these towards the bottom of the garden. Let's do the life-threatening side effects first. There's an ice cream vendor in the park. He's got 3 ice cubes that contain a brain, a heart, and a pair of lungs to represent CNS, cardiovascular, and respiratory depression. The one with the lungs is crushing an unfrozen brain, which represents increased intracranial pressure. Remember that opioids are contraindicated after head trauma, like when it gets crushed by a large block of ice. Next, let's go over some less severe side effects. First, we have the park's famous statue of a man sitting on the toilet called the Constipated Man. He's got a pin sticking out of his eye for pinpoint pupils, and his cheeks are red, representing flushing. This is very upsetting for a couple in the garden, representing dysphoria. The woman is pregnant to help you remember that opioids should be avoided if possible during pregnancy. And the husband is vomiting on a giant gallstone by the statue, which serves as a reminder that opioids cause nausea and they are also contraindicated in people with biliary colic. Finally, at the foot of the statue, there are some empty beer bottles to help you remember that opioids should not be used with alcohol or other medications that cause sedation. Alright, as a quick recap, opioids stop inhibitory neurons from releasing inhibitory neurotransmitters, which allows dopamine, norepinephrine, and serotonin to flood the thalamus, brainstem, and spinal cord, reducing the perception of pain. Opioids are classified as full agonists and partial agonists. Full agonists include morphine, fentanyl, meperidine, codeine, and methadone. They are more potent, but have more severe side effects. Partial agonists include buprenorphine, butorphanol, pentazocine, and tramadol. Opioids can cause side effects like nausea, vomiting, dysphoria, pinpoint pupils, constipation, biliary colic, and in the worst cases, coma, cardiac depression, and respiratory depression. But wait, there's more. Here's a mind map with all the mnemonics. Go ahead and pause the video so you can test yourself and see what you remember. Stay tuned for the answers after the credits.